Jason Parker had been smoking since he was 16. It had started innocently enough. A cigarette passed around in the high school parking lot, a symbol of rebellion and maturity. By the time he reached his mid-20s, smoking was more than a habit. It had become a part of who he was. He lit up whenever he felt stressed, whenever he celebrated, whenever he was bored. His apartment smelled faintly of tobacco, and his friends joked about the smoke cloud that followed him everywhere. One crisp autumn morning, Jason sat on his small balcony, overlooking the city. The sun was rising, painting the skyline in shades of orange and pink, and he held a cigarette loosely between his fingers. He had promised himself last night that today he would cut back, maybe even quit. But as he watched the smoke curl into the cool morning air, he felt a familiar pull, a temptation he could hardly resist. Across town, Emily Thompson, a nurse at the local hospital, was finishing her morning rounds. Emily had grown up watching her father struggle with smoking. He had been hospitalized more times than she could count, each visit more serious than the last. Emily had always promised herself she would never let smoking take over her life. She knew firsthand the damage it could do, not just physically but emotionally, to everyone who loved the smoker. Later that day, Jason received a call from his doctor, Dr. Martin Lewis, a tall man with a calm presence and a no-nonsense attitude. "Jason," Dr. Lewis began, "I've gone over your recent tests. Your lung function is declining faster than I expected, and your blood pressure is creeping up. If you continue smoking, you're looking at serious complications within the next few years." Jason felt a lump in his throat. He had suspected that his health was declining, but hearing it directly from a doctor made it real. He tried to laugh it off. "Doc, I've been hearing that for years." "I'm fine," he said, though his voice betrayed a hint of uncertainty. "You're not fine," Dr. Lewis said gently. "You might feel okay now, but smoking is a slow-acting killer. You need to seriously consider quitting, Jason. The earlier you start, the more damage you can prevent." That evening, Jason sat alone in his apartment, cigarette in hand, thinking about the call. He thought about his younger brother, Matt, who had always looked up to him, and his sister, Claire, who worried about him constantly. He realized that smoking wasn't just affecting him, it was affecting everyone around him. He thought about the mornings when he woke up coughing, about the shortness of breath he ignored during his runs, and about the constant worry his family carried. Emily, meanwhile, was working her evening shift at the hospital. She often encountered patients like Jason, people who smoked for years and then faced life-changing diagnoses. One patient, Mr. Anderson, had started smoking as a teenager and was now fighting lung disease. Watching him struggle, Emily felt a renewed sense of urgency to educate people about the benefits of quitting. She wanted to help them avoid the path Mr. Anderson had taken, to give them a chance at a healthier life. The next morning, Jason decided to take a walk. He wandered through a park near his apartment, the leaves rustling under his feet. He noticed families enjoying the fresh air, joggers running energetically, and children playing without a care in the world. He felt a pang of envy and guilt. He wanted to be part of that healthy, vibrant life, but he knew he couldn't as long as smoking controlled him. Jason made an appointment with Emily's clinic. He had read about her work in helping patients quit smoking and decided to reach out. When he arrived, Emily greeted him with a warm smile. "Hi, Jason. I'm glad you came in today," she said. "Quitting smoking is challenging, but it's one of the best decisions you can make for your health." Jason admitted that he had tried quitting before but always relapsed. Emily listened carefully and explained that quitting was not about willpower alone. It was about creating a plan, understanding triggers, and finding healthier ways to cope with stress. She introduced him to nicotine replacement therapies, counseling sessions, and support groups. She emphasized that setbacks were normal and didn't mean failure. Over the next few weeks, Jason's journey was difficult. He faced cravings that felt almost unbearable, moments of irritability, and nights when he dreamed of lighting a cigarette. But Emily's guidance and the support group kept him accountable. He learned to replace smoking with walking, meditation, and journaling. Slowly, he noticed changes. He could breathe more easily, his sense of taste improved, and his energy levels increased. He even found himself enjoying mornings without the foggy haze of nicotine. Jason's family noticed the change too. Mao was inspired by his brother's determination and even started exercising with him. Claire felt relieved knowing that Jason was taking his health seriously. The apartment no longer smelled of smoke, and for the first time in years, Jason felt a sense of control over his life. Months passed, and Jason had successfully quit smoking. He reflected on his journey and realized that giving up smoking wasn't just about avoiding illness, it was about reclaiming his life. He could now fully participate in activities he once avoided, enjoy social gatherings without the constant need for a cigarette, and feel confident in his body and mind. Emily continued her work, helping more patients like Jason. She knew that each success story was a ripple effect, influencing families, communities, and even generations. She believed that by educating people and providing support, the habit of smoking could be replaced with healthier, more fulfilling choices. Jason eventually became an advocate himself. He shared his story online, spoke at community centers, and even volunteered at Emily's clinic. He wanted people to understand that quitting smoking was hard but possible, and that the benefits extended far beyond physical health. It was about freedom, vitality, and the chance to live fully. One day, while sitting in the park where his journey had begun, Jason watched children running and laughing. He took a deep, unencumbered breath and smiled. He knew that he had made the right choice. Giving up smoking had given him back his life, his health, and his peace of mind. It had allowed him to reconnect with the world around him, to experience life in its purest form. Jason's story became a beacon for others struggling with smoking. He reminded people that quitting was not a sign of weakness, but an act of courage and self-respect. He emphasized that every day without smoking was a victory, a step toward a longer, healthier, and more fulfilling life. Through persistence, support, and determination, Jason had transformed his life, and in doing so, he inspired countless others to do the same.